This is an election year here in the state of Rhode Island. Every 2 years is an election year in the state of Rhode Island because our General Assembly is up for election every cycle, every 2 years. So that's Rep. Kislak, Rep. Kassar, all the reps, all the senators here, they're up for re-election potentially this year. So pay attention, listen, and if you like what you hear, feel free to support them. If you don't like what you hear or you wonder why they're not here or what have you, take that to the ballot box in September, which is the Democratic primary, and then November, which is the general election. And we will keep it moving here with our next speaker, who is another healthcare professional. This is Dr. Ben Brown from Brown University and Women and Infants Hospital.
Good evening, everybody. I am so happy to see so many people here. Thank you for turning out. Thank you for turning out on short notice. Thank you for making your voices heard. So, yes, my name is Dr. Ben Brown. I am an OB-GYN. I do labor and delivery care. I provide birth. Hold it closer. All right, you got it. How's that? Can you hear me now? I thought I was talking really loud, but I can talk louder. I have a loud voice. We can do this together. I'm an OB-GYN. My name is Dr. Ben Brown, and I'm an OB-GYN. I provide birth care for folks of all risk levels, high-risk complex pregnancies as well as average-risk pregnancies. I provide emergency care at Women and Infants, and I also provide abortion care as part of comprehensive health care for folks with uteruses. Friends, I came to this work because I'm a Quaker. I came to this work out of a sense of love and a sense of calling, a calling to service, a calling to be of use to the communities that our patients come from, the communities that I am a part of, and for communities throughout Rhode Island. That's why I do the work that I do. I believe in being there for patients. I believe patients deserve somebody who can make the healthcare space a safe space, where we can center their voices, center their needs, hear their values, and provide the care that they need based on those values, based on where our patients are coming from. That is what I strive to do every day in caring for patients. And I know that I speak for so many of my colleagues in saying that. That is what we are here to do. We want to make healthcare spaces safe spaces and supportive spaces for all of our patients, for all Rhode Islanders. And I also know that abortion bans hurt people. Abortion bans hurt communities. They are dangerous. And they are not okay. I want to tell you, I trained in Chicago. I trained in the Midwest. And Chicago provides care for a huge swath of the country where people have poor access to abortion. And I saw patients, every clinic who had traveled to see our office from other states, from Indiana, from Wisconsin, from Iowa. People had traveled hours. I saw that every clinic. I saw patients who had to take time off of work. I saw patients who had to raise extra money to pay for the gas just to get to the city where I was working. I saw patients who had to navigate an unfamiliar city, find a place to stay. And every time I would care for one of those patients, I would think about all the patients who didn't have the resources to surmount those barriers. Who were the patients who couldn't get to that care because they couldn't surmount those barriers? That is the reality that is coming our way in the face of what we expect from the Supreme Court. But friends, we are strong. We are going to fight back. We are going to do that together, and I believe that we can do that. I believe that we can make abortion access a reality. So I want to say, if you are new to this movement, welcome. We are happy to have you. Thank you for joining us. And I want to encourage you to do a couple of things. I want to encourage you to listen. Listen to the work that is ongoing. Ask how you can take part in it. Ask what you can do. But don't just listen to people like me. Don't just listen to doctors. I want you to listen to the reproductive justice advocates who have been doing this for years and years. And in the clinical space, I want you to listen to the people who answer the phones at the front desk. I want you to listen to the medical assistants who guide patients through care every step of the way and hold their hand every step of the way. I want you to listen to patients, to their family members. Listen to the people who are speaking for the communities that are affected by abortion bans and the people who are affected by accessing abortion care as part of their comprehensive health care. And then I want you to donate to abortion funds here and around the country. And I want you to vote. Vote for people who will support the Equality and Abortion Coverage Act here in Rhode Island to make our state a better haven, a safe place where people can get whatever care they need. And for everybody involved in this movement, the people who have been here for 5 minutes, 5 years, 5 decades, I want to take a moment to remind you that in a challenging time, in a scary time, we owe each other love each other, uplift each other's work, show each other solidarity, and then let's fight like hell for our patients, for each other, and for our communities. Thank you, everybody.